This is your perimenopause survival guide, so let's dive in. So the first thing that I want you to know is that there are so many random symptoms that you could possibly have that may be related to the change in hormones. And no, you are not crazy. You are not imagining the new onset itching, all the dryness, and I mean dryness everywhere, if you know what I mean. Maybe that new onset in swelling, maybe even some things like frequent urination. All of these may be symptoms that can be attributed to your change in hormones. Of course, a lot of us are aware of things like insomnia or difficulty sleeping, even the mood swings, the brain fog, the weight gain, the muscle aches, the joint pain. Sometimes will even flare if you have a pre-existing autoimmune condition. So there can be so many symptoms, and I just want you to be aware that sometimes it can be related to perimenopause, or perimenopause can increase the pre-existing symptoms that you may have. So just know that, and no, you are not crazy. You are not losing your mind. Yes, things are changing. That is for sure. So the next thing to know is that, yes, there are some testing options, but no, there is not one definitive test that we necessarily do to determine whether or not you're in perimenopause. It's a combination of looking at symptoms. So all the things I mentioned, the brain fog, obviously any irregular cycles, changes in bleeding, et cetera, et cetera. So we'll look at that and we'll ask you, well, what has the pattern been over the last few months? And on top of that, yes, we could do things like blood testing. We can look at, typical hormones in blood, looking at FSH, LH, estradiol. Sometimes we'll look at progesterone, et cetera, et cetera. So all your typical sex hormones we can definitely look at. And a lot of times, especially in perimenopause, because the fluctuations can be so wild, and it depends on the timing of when you take the test, that it can show up pretty regular, which I know is not terribly helpful. So again, making sure that you're tracking your symptoms and maybe keeping a log of your symptoms. Notice that if there's any timing that comes along with that, is it a certain time during the cycle? If you still are having regular cycles, or if there are any triggers that you notice make things worse. Sometimes we can find in the testing that there are huge fluctuations that are outside the range that will definitely say, oh yeah, you're probably in perimenopause. We can also do things like, what I like to use are things like the Dutch test, which is dried urine hormone test, which looks at, estrogen, progesterone, testosterone, DHEA, also things like cortisol. And for me, this makes a difference because it's also looking at different pathways and which pathways you're favoring as your hormones are fluctuating or changing. And that, for me as a naturopathic doctor, helps me decide which herbs or which supplements may help support the pathways that need that additional support. And so this is where, for me, we get into deciding what is right for you. So there are many different herbs and supplements to choose from when it comes to looking at supporting you through this time. There's, Chinese herbs, there's Western herbs, there's vitamins and other supplements that we can use. And then, of course, as well, I will often use things like, oral micronized progesterone, or even estrogen, be it in creams and patches and pills, whatever. It kind of depends on where you are in your journey, what you want as a patient, and, what is really, in my clinical opinion, going to help. Again, I always counsel that it is up to you to decide what is right for you, but you should talk to a provider that knows the pros and cons, that can talk to you about the benefits of each different type of modality. And, when we're talking about prevention, I always have the conversation surrounding using bioidentical hormones. I always have the conversation surrounding the positive, preventative benefits as well as the side effects as well. Severity of your symptoms, what your preferences are, kind of where you are in the journey, so timing, all of these are going to factor, and also, of course, your health history. That kind of goes without saying. But all of these are going to factor into having that discussion with you and being a bit better able to educate you about what's going to be right for you, what's appropriate for you, and allowing you to make really an informed decision. So for me, treatment-wise, because I am a naturopathic doctor as well as acupuncturist and Chinese herbalist, what I tend to do is use something like a Dutch test along with your symptom history to determine which herbs, supplements, or medications we need to move forward with. So when it comes to herbs and supplements, There's a lot. So for me, thinking from our herbal route, there are the classic Western herbs. There is the black cohosh. There is the maca. There's dongui. Angelica sinensis. A lot of classic, supportive herbs that sometimes we'll use during perimenopause. For me, in Chinese medicine, there's dongui, there's bai xiao, there is the classic formula Liu Wei Di Hong Wan, or I think it's called like the 6 treasure tea pills, the classic formula that we use during perimenopause and menopause. There are a ton of things. And again, these for me are always going to depend on what symptoms you're having, because everybody doesn't present with night sweats and hot flashes and insomnia or brain fog. It can show up in different ways. Again, this is why I like to use additional testing like the Dutch test, because if we go through and see that you need more antioxidants, then maybe we're adding in something like glutathione, which maybe we wouldn't traditionally think about during perimenopause, but it can be a time when your body is going through extra stress, burning through maybe B vitamins, maybe you need magnesium, all these things that are different cofactors and metabolic processes in the body. And adding these in, or knowing specifically that that is what you need, is going to reduce the frustration, reduce a little bit of friction, and make it a little bit easier to help support whatever it is that you need in your particular journey. So it's not that I'm a huge advocate for these tests. It's more that it makes it easier for me to do my job, makes it more streamlined for you as a patient as well. And of course, there are other herbs and other categories we may bring in. A common one that I often use are adaptogens. Again, it's going to vary on maybe what you need. I often will look to your cortisol response to determine, is ashwagandha or rhodiola going to be a better choice? Or maybe we need to bring on ginseng, or maybe we need more calming herbs, or things like, avena or oat. Maybe we need passion flower, or maybe you have trouble sleeping and we need to bring in jujube or the ziziphus or valerian or something like that. For me, there never really is a one size fits all. Yes, I have my categories that I choose from and maybe my top shelf. Oh, when I see this pattern, I use this, but it's always going to be dependent for each individual person. And I just want you to know that this type of customization is available. Please, I know I get a lot of comments on the channel, but like, why are you telling me to ask my doctor? Look, y'all, we're on the internet. I can't just be telling you what to take in the comments. I love you so much, but I can lose my license. And that, like, I'm not your doctor here online. But what I can help to do is coach you through it, help to educate you as to what is available. And if you would like to do a consult with me, we can do some coaching. We can work on other factors as well. And, these are all ways in which I'm trying to empower you and to help you understand, what's going on in your body and what the heck are your options. Because I feel like we really lack this in our traditional healthcare, especially for women. That's a whole other tirade. Speaking of those lifestyle interventions I like to talk about, there is, of course, resistance training. If you have not been doing resistance training and you are now going through perimenopause or think that you are, this is a perfect time to add it in, because those hormones, especially estrogen, are changing and they are dropping, and they are going to continue to drop. We, as of yet, have no cure for, menopause. It's all going to happen to us at some point. So we need that estrogen to help us build lean muscle mass. Again, if you saw a previous video where I talk about longevity, and I talked about optimizing your hormones, and I talk about muscle mass being a huge predictor as far as the quality of life that you live and the type of longevity that you have. So with women especially, making sure that we're doing everything to maintain that lean muscle mass, be it from optimizing your hormones or to adding in that resistance training, going to be super important to make you either build or maintain what you do have. On top of that, of course, we got to look at our nutrition. We can't actually build muscle if we're not fueling our body. So making sure that you're getting enough protein, or prioritizing protein, I like to say. I have a range that I like to kind of stick to, or a starter range, and then we tweak that based on, maybe you also have some weight loss goals that you want to look at, or maybe we have some muscle mass goals that we're looking at. So making sure that you're checking in with how much protein you're getting and making sure you're getting enough, making sure, of course, I don't ignore the other macros. I don't go on extremes, looking at your carb intake, looking at your fat intake as well, because you still need fats to actually make hormones too. So Let's not forget that. I don't demonize any of the macronutrients, but I try to find a balance that works for your lifestyle, that works for your dietary preferences, and that is going to work for your goals and also for your longevity, and also working to maintain hormonal balance. One part of the conversation that I feel is missing when we talk about surviving perimenopause is looking at that mental, emotional, and spiritual component as well, because this is during that time when your hormones are changing and your life is usually changing. We're moving into a new stage of life when you're entering through perimenopause, menopause. Your priorities may change, your goals may change. You may realize that some things you're doing are not actually making you happy. Because as women, we can get irritable because of these changing hormones. It makes us actually start to look at the things that are no longer serving us in our life. And it makes us look at the things that are not bringing us joy. And sometimes our priorities can shift. And sometimes we are a little reluctant to shift with them because we have been doing things for so long in the same way over and over. People are expecting you to show up in a certain way. And you may now start to realize that I do not give a crap about this thing that, this person is expecting of me. It can be shifts in your family dynamic, your relationships dynamic, in your work dynamic, in your goals, in your finances, et cetera, et cetera. And I think that if you are not taking into account your mental, emotional, and spiritual wellness as well during this time, you are doing yourself a huge disservice. And I think that sometimes if we're not looking at that, it can also make transitioning through this period of life so much more difficult. So this is where I bring in practices like, meditation. It's going to, and breath work and journaling. These are all activities to not only bring us into more of a parasympathetic system dominance, but it also is bringing in awareness. And awareness, this is where we shift into that more emotional and that more spiritual aspect as well. And when I talk about the spiritual aspect, I mean are we in line with what we came here to do on earth? Are we walking in our purpose? Because again, I'm bringing this up because at this point in time when, hormones are changing and we're shifting into a new era in our life, this a lot of times I'm noticing in my practice and, both online and in person that these bigger questions start to get asked. Then they become more important to us and they come to the forefront more so, and they show up in our lives, and it usually shows up when we're also having a bad time because our hormones are shifting. So having some practices that are going to bring awareness to this and, make you start asking these questions, because you might be wondering, why am I even wondering this? Because maybe it's something you've never dealt with. So making sure that this is on your radar and making sure that you have some practices in place to kind of help work through this, I think is super, super important. It's part of your overall health and wellness. The reason why I am a naturopathic doctor and an acupuncturist is because I truly believe mind, body, and spirit all need to be in harmony. And this is what we need when we think about our overall health and wellness. We have ignored this or taken this aspect out in our Western medicine for so long, and it's really time to just change that. So what better time than when feels like your life is falling apart anyway because your hormones are changing. So I joke, but I'm also serious in this, in that it's just something I've seen over and over and over again in my practice. So that was a lot, but I just want to make sure that you know what testing is available, what symptoms may look like, what type of support, both herbal, supplement, lifestyle, nutrition, medication, what is available to you, as well as bringing in those practices to support your mental, emotional, and spiritual health as well. So if you have any questions, or if you would like to work with me, because this is a common thing that I deal with, you can look at the link in the description box below and you can find out the way that is best for you to work with me. I have a couple different options down below. If you have any questions, as always, leave them down in the comments. And if this was helpful for you, or if you know someone that this might help, please share it, because it does help other people find this information. And again, my goal is always to empower and to educate. So hope that this was helpful, and I will see you in the next video. Bye.